everybody. We are back with the Diabetes Eating and Wellness session. This is our diabetes education group. Of course, we're on here with LWell, which is a group private practice for dietitians and others involved in diabetes education. Today, I'm so happy again to announce Julie Nance, our main instructor here for this series, is with us again. She is a registered dietitian nutritionist or a certified diabetes care and education specialist, and she will be leading today's presentation. So take it away, Julie. Thank you so much for being here again.
It's a privilege to be here because we have to engineer how to eat healthy in this crazy time, especially in this crazy time that we're in now. So let's look at some let's look at some of the things that we can do for problem solving, because we do have to solve some problems when we have diabetes, right? I think most all of us run into some type of problem at least once or twice a day, not just a week, but a day that we have to kind of face. So most of us have a healthcare team, and this is this group of people around us that help to support us. Even when we're doing great, they help to support us, but they're really great whenever we're not feeling so well, in order to help us to feel better and to make sure that our blood glucose levels stay in control. So there is a huge list here, and I know you can see this big list. The top one is a Friends with Diabetes. One of the things that I do want to point out here is it is great to have friends with diabetes. And if you look around, or if you've been to a group meeting, you can find lots of friends with diabetes. But be careful that you have a friend with diabetes that has also had some diabetes education. There is a lot of myths and folklore out there about diabetes, and we don't want you to travel down the wrong path with the wrong information. We want you to have the right information, which is why you're here, right? So you can get the best information possible. Maybe you can be a good friend with diabetes to someone else who has diabetes and share some good information with them. And among this group is a list of all of your healthcare providers. This includes the nurse and the physicians in your practice. It could be a nurse practitioner or a PA. All of those can help you with diabetes. It can even be your fitness professional. Yes, it can. If you go to the Y, if you go to a gym, all of those can help you. So this is all on a team, and they all want to work together to make sure you stay as healthy as possible. We want to start off with one of the problems that some of us can run into is called hypoglycemia or low blood sugar. We mentioned this in the introduction class. So now we're going to talk a little bit more about what is a low blood sugar. It is defined as a blood sugar that's less than 70 milligrams per deciliter. If you've never had a low blood glucose level, then you're going to know it the first time you ever have it, because you're going to feel it very, very anxious. There are a number of symptoms that can occur whenever blood glucose levels drop pretty low. Those symptoms are actually a warning your body gives you to let you know something's not right and you need to take care of it. So the sooner that you know you have those symptoms, and those symptoms can range anywhere from sweaty to shaky to anxious. Anxiety, I think, is one that a lot of people tend to feel, but it can even be a headache, or it could be feeling fatigue. So there's a lot of different symptoms, and paying close attention to those symptoms are important. Your body will tell you everything you need to know. You just got to learn to listen to it a little bit. All right, so when you do have those symptoms, the first thing you want to do is prick a finger and test it and confirm that that blood sugar is actually low. Now, some people may not have symptoms. I have what's called diabetes. Yeah, I do have diabetes, but I also have what's called hypoglycemia unawareness. So that means my blood sugar levels can drop very low and I still don't feel it. I don't have those warning symptoms that let me know I need to take care of it. And a lot of times I may not feel it until I can't think very clearly. And that's because your brain loves and lives off of glucose. So when your blood sugar levels are low, that means not a lot is going to the brain and it can't think very clearly. So sometimes when I can't think very clearly, I go, let me go test my blood sugar and see what it is. And if it's low, then I know that I have to treat it. So the first thing we want to do after we test the blood sugar and we do confirm that it is low is we want to make sure that we treat. And that's eating something that contains 15 grams of carbohydrates. Now, what's the difference between 15 grams of orange juice and 15 grams of a cracker? Well, 15 grams of orange juice is liquid, which means gravity is going to pull it down and it's going to absorb much faster. Usually within 15 minutes, blood sugar levels can rise anywhere from 25 to 50 points with something that's rapid. Now that cracker, that 15 grams of carbohydrates that's in that cracker now has to be digested. So it's going to take longer for the sugar, the glucose, to get into the system to raise your blood sugar levels. So it's always best to eat something or drink something that's going to work a little bit faster in the body. Glucose tabs are wonderful. Anybody who has diabetes and is on insulin should keep glucose tablets with them in their purse, in their pocket, wherever they can, should have them with them all the time. I have some in my bathroom. I keep them in my purse. I have them in my office at work. So I have them whenever I need them. So they're kind of my insurance. Just like you have insurance for your car, just in case something happens. My glucose tabs are my insurance. I also like to take a snack to keep in case it starts to drop again or to keep it from dropping again. All right, so we have 15 grams of carbs. We consume it. We wait 15 minutes. One of the things that can happen when blood sugar levels do drop really low is that anxiety. You're going to want to eat everything you can find until your feet feel better. You don't want you don't want to eat for 15 minutes because that could cause that blood sugar level to go from 50 to 250 fairly rapidly. And then we're on that roller coaster ride. We don't want that to happen. We want to wait 15 minutes. It can be a little bit tough to do, but if you just sit for a moment, give yourself a second or two, you'll start feeling better slowly, but give it time. So after 15 grams of carbs, you wait 15 minutes and then you prick fingers again. Not fingers, a finger. Prick a finger again to make sure that it's now over 70. If it's not over 70 again, let's do another 15 grams. So that means if it's not over 70 yet, then you need another 15 grams. 15 grams of juice is good. Milk, preferably low-fat milk, is better. Glucose tabs are good. You could do 5 Lifesavers or 5 peppermint candies. You can do 12 Skittles. Yes, I know. Exactly 12 Skittles are 15 grams of carbs. I love Skittles. Those are some of my favorites. I don't usually keep them with me, but whenever I find Skittles, I can use those. So you can use something, but make sure that you keep it at about 15 grams because we don't want that blood sugar, instead of rising up to 50 points, it rises to 100 and 200 points. We don't want that to happen. All right, so if it is after, wait another 15 minutes, test again. Once it's over 70, then you're okay. You don't have to eat again. But if you're not going to eat within an hour, a meal, let's say this happens at around 2 o'clock, but you're not going to eat your supper meal until 6, then you might want to have a little bit of a snack. This can be an apple, maybe with some peanut butter on it. Something that's going to be preferably nutritious, thank you, but this could be something that's just little. It could be a half of a kind bar. It could be oh my goodness, help me think.
Sure, just even like a little handful of nuts or one of those pre-portioned nut bags. I always like those. Or finally, this is the time to like have the spoonful of peanut butter, just one little one, because that can get can get going really quickly. But you're looking for something that's not a fast carb. It's not going to hit your bloodstream really quickly, because then of course then that kind of provokes that panic eat too, where all of a sudden you're overeating without needing to. So, something with a little bit of protein, fiber, or a little bit of fat, is one way just to kind of keep that blood sugar level up, but not too high. So I'm with you then. So we do the test, treat, then eat, but really more of a test, treat, test, treat if necessary. And then with the end, you can get a little snack if dinner is a long way away.
Yes. All right, medical ID. Why? Caroline, tell me, why do I need a medical ID? What's the big deal about this thing?
If something happens, let's say the worst case scenario, right, which we never want to have happen, but just in case it does, that you have a situation where you've passed out or become unconscious, and maybe it has to do with diabetes, or maybe it has to do with a fender bender. We just want to make sure that anyone who comes to your care knows what to do in case of a hypoglycemic episode, for example. Maybe there's instructions there about what to happen, how to use the glucose tablets, what medications you're on, including insulin, and who to call. So that medical ID can be really, really useful. Some people will use just a wallet card. Other people use a bracelet that then says to go look into the wallet. There's lots of tools now to communicate your health status so you get the best care.
Absolutely. Medical IDs are actually really important. I've been in 7 car accidents, not on my fault, but I figure my wrists are pretty doggone good that I could have another one. So I make sure I wear a medical ID. And mine says on the back of it, it says type 1 diabetes, and it says insulin pump too. So this, just in case I'm in an accident, my pump goes one way because it can detach very easily when there's some type of force. So my pump disappears, no one's going to know that I have diabetes. If I'm in a car accident, I go to the hospital, what's the first thing they're going to give you? An IV. And they may give you an IV that has glucose in that bag. So they need to know if you have diabetes so that they can give you a different type of IV that's not going to contain a large amount of glucose. Anytime that there is pain or injury or illness, blood glucose levels will rise. It is your body's response to that injury or to that illness. So if there's an accident, then blood sugar levels may automatically rise anyway, so they may give you some glucose, and then blood sugar levels are going to go even higher. So I have a bracelet. Yes, mine are kind of frou-frou, so you don't have to have anything that's frou-frou. It's not necessary. Actually, one of my 17-year-old patients that I saw had it tattooed. He had it tattooed. He had actually one just like this, but he had type 1 diabetes tattooed underneath it on his wrist. No, you don't have to do that. That's not necessary. But there has to be something on you somewhere in a wallet. It can be a wallet card with all your information on it. It doesn't have to be anything huge. You don't have to wear a big bling, a lot of bling. You don't have to wear a flashing sign that says diabetes. Not necessary, but that you have something that they can go through. Many times, if you're in an accident, the paramedics are usually trained. They need to find out who you are. So they may go through your wallet and find it. So make sure that card is either right behind your driver's license, somewhere that's going to be easy access for them to find that. All right, so Kevin has type 2 diabetes, and he states that he gets distracted often, and he misses his insulin boluses and or his oral meds. Well, my goodness, how many of you get distracted? Caroline, do you get distracted very often?
it's a very human thing. You know, we forgive ourselves.
It is very, very human. Yeah, what would you do if you did get distracted and you missed your insulin injection, or you missed your oral meds? Well, the thing is, we are human. There was the other day, I forgot to give myself insulin at breakfast. I've been doing this for almost 30 years, every single day at every single meal. So you would think that I would remember it, right? No, sometimes things happen. We are all human, and sometimes mistakes happen. So that's okay when it happens once in a while, but when it is consistent, then that medicine is not doing you any good. And that's going to cause those blood sugar levels to go a little bit higher. You know, what could help out with this? One of the things that could help out, setting on your phone, setting alarms on your phone or your watch. If you have one of the iPhone watches, which I don't have, even that can help out. Or just a simple watch, if you have an alarm on it, can help. Anywhere that there's something to remind you. If it's on the refrigerator door, put a note. I'm a sticky note person. Oh, I'm a sticky note person.
It helps, right? Bathroom mirror.
Yes, bathroom mirror, refrigerator, cabinet door, wherever it is that you may frequent often, put it there. What is something that you do just prior to a meal? You test the blood sugar, put it there. Put a sticky note. Remember to take insulin. You know, something that's going to remind you to do it. All right, glucagon. You may have heard of glucagon before. You may have seen glucagon before. Those who are on insulin are the ones who really should have glucagon in your house or with you at some point in time. Glucagon is an emergency kit. Though your body creates glucagon, your pancreas will secrete glucagon when blood sugar levels are low, and it tells that glucagon tells the liver, it's actually a hormone in your body, it tells the liver to dump some sugar into the body to bring blood sugar levels up. People with diabetes have some dysfunction sometimes with glucagon. So we may need to have a glucagon emergency kit with us. It's really important. When blood sugar levels drop extraordinarily low, having a glucagon available can help to bring them up enough to where paramedics probably should come. The only time that glucagon should be used, if you should never have to use glucagon on yourself. Let's put it that way. So if you have to use glucagon on yourself, you could have easily eaten something or had glucose tabs or juice to bring blood sugars up. The only time glucagon should be used is when you can't give it to yourself. That means you are so severely low that either you are not conscious or you're not capable of giving an injection. You can't think clearly enough to give yourself, to draw this up and to give yourself the injection. So that's kind of the most important part, is if you can give it to yourself, you can go and get yourself something to eat. All right, so it's very simple, usually in a very simple little kit like this. Liquid, well, it's actually a powder, sorry. And liquid. Now, this is the other thing that I always say. This is a pretty big needle. I don't know that you can see that. That's a pretty big needle. The recommendation is in your thigh, because that's the largest muscle in your body. This needs to go in intramuscularly. It's the largest muscle in your body. You're going to be out anyway, most likely, or not conscious enough to understand what's going on. You're not going to feel it. So don't worry about that. If the person who's giving it to you, they might freak out with it.
Don't get a squeamish partner. Sorry.
Yes. I never trained the first time that I should have been able to have one. My husband, I never trained him on how to give it to me. So the first time it happened, my blood sugar was less than 19. I was unconscious, and he had no clue what to do. So you have to get this liquid into this vial, shake it, and then pull it back into here. I never trained him. So what happens in that situation is You're nervous. The
Yeah.
person is scared. They're nervous. They're already kind of freaking out anyway because you're unconscious. So training the person who's going to give this to you is going to be the best way. So there's powder in here. There is liquid in this. Liquid is injected into here. Shake it up, make sure that powder becomes a liquid, and then you pull it back into this syringe, and then that goes boop into your thigh. Is the best place to put it.
So identifying a person who shares your home or is, or is would be familiar enough with you and your existence to know when something was dreadful, they'd have to test your sugar too, right? Or would you just tell them to go ahead and start with the glucagon? I mean, because you'd have to train them both ways, right?
You really would. You'd really have to train them both ways. If you're somewhat conscious, if you're unconscious, give it to them.
Mm-hmm. Just do it.
Yeah,
Okay.
just go ahead and do it. Get it in there. I think that's you're going to bypass that testing. You can test it afterwards, but the important part is to go ahead and get the glucagon in to start bringing blood sugar levels back up again. If there are, for me, the symptoms were I was sweating so bad, the bed was completely wet, but I started seizing. So that's a really big indicator. If there's a seizure, if the person has diabetes, is on insulin and is unconscious and starts seizing, that is usually a big indicator that blood glucose levels are extraordinarily low. So that he had to call 911 because in that shaking, it broke the needle. So calling 911 is the next step.
Okay.
Get on 911. Even though that glucagon will bring blood sugar levels back up, 911 still must be called just in case it doesn't come back up the way it should. These do have an expiration date on them. Usually they'll last for about a year. They do need to be replaced. They are prescription only. But they do need to be replaced every single year. I have not used one in 20 plus years. We've not had to use one, but I have two in the drawer right now. I just had refilled. I have them refilled every year. They are, again, insurance to make sure that I'm going to be.
Okay. So Julie, and this, do you happen to know a percentage of insulin dependent diabetic patients who require glucagon?
Of the who have had to use it or who require it?
Oh, that's a good question. Let's say, how many would ideally have used it? Sometimes people present to the emergency room and might have been able to handle it, themselves. But how many times a year or not times a year, maybe, what proportion of insulin-dependent diabetic patients must use glucagon or have used glucagon in the lifespan of their condition?
It depends on the individual. Mm-hmm. It depends on how poorly controlled they are. Poorly controlled doesn't necessarily mean really high blood sugar levels. Yeah. Poorly controlled can also mean consistently low blood sugar levels. So somebody who has consistently low blood sugar levels probably uses them far more often than someone who is well controlled or is even somewhat well controlled. Or somebody who has them high all the time, they're not going to need them. Not going to need a glucagon. But somebody who has low blood sugar levels or doesn't pay attention or does not test blood sugar levels, that doses insulin without counting carbs, mm-hmm. and knowing what their blood sugar levels are, then that's somebody who may be at higher risk for needing. What the exact percentage is, I don't know. But there are people who probably use them far more often than others.
Interesting. All right. Well, thank you for that. That's a lot of topic. That's a lot of content for that slide.
Oh. All right. Nocturnal hypoglycemia. What does nocturnal mean?
Nighttime.
Very good. Nighttime low blood sugars. This is where mine happened. Mine was at nighttime. Mine occurred in the middle of the night. And a lot of times we have low blood sugar levels. There's a couple of different reasons why it can happen. One is called the Smogy effect. I just love to say it. But that smogy effect usually ends up with a really high blood sugar afterwards. So it's called a rebound. And a lot of times we may not feel that low blood sugar because the blood sugar drops very, very low and then it rebounds to really high. But with nocturnal hypoglycemia, this can occur. Maybe you didn't eat a snack before bedtime. Maybe you gave yourself insulin. People who are on a basal insulin, like Lantus, for example, may give themselves insulin before bedtime. There is a 2-hour onset for that particular insulin. So about 2 hours later is when it really kind of starts to work. And if they didn't check their blood sugar before bed, they gave themselves their insulin, blood sugar levels may start to drop a little bit in the middle of the night, especially if it's a new dose. Maybe the physician increased the dose a little bit. It may drop in the middle of the night. Somebody who may be on a rapid acting insulin is at even higher risk for dropping low at nighttime, especially if basal rate, especially if that insulin dosage may not be correct. But testing a blood sugar before bed is one of the best things that you can do to prevent it and eating a snack if it's necessary. So there's nightmares is one of the first things. I used to have a lot of nightmares, and that would wake me up, and I would realize I have a low blood sugar. Sweat is also really big. I've actually woken up before, and that night that my husband had to call 911, I was completely drenched. My hair was completely soaked, and I was completely drenched. The bed looked like somebody threw water on it. It was that much sweat. Seizures and thrashing, yep, had it, and cannot be easily woken. A lot of times those individuals may actually be unconscious. So they've gone past can't be unwoken to completely unconscious and out. A bed, if blood sugar levels are less than 100 before bed, then a snack is recommended. Be careful with how much you eat though, otherwise you're gonna deal with a really high blood sugar. Not a big bowl of cereal, but a small snack usually is okay. Usually my snacks may either be a couple of graham crackers, not 3 squares, which is 18 grams of carbs. Not three of the squares. I may only have 1 square and then about a half of a cup of milk, and I'm perfectly fine. Last night I didn't have any snack. Didn't need one. Blood sugar was perfectly fine before bed. I didn't have one. Woke up this morning, blood sugar was 90. So it just really depends on the individual, what's going to work best for you and what insulin dosage levels are or what medication that you're on. All right, Faye says, I'm afraid I'll go too low, so I keep myself a little on the high side to be safe. This is probably someone, Caroline, you can tell me, this is probably someone that has had a low before and it scared her to death. So
I feel like I've talked to many Fays in my life. And,
yes.
So I think that, yeah, there is a genuine fear about going
Yeah.
low. And so especially if there's been an instance before, or if they've known someone, of course, that has had that experience.
Yeah, and it can be a little bit scary the first time, and I always say the first time you have one, you're never going to want to do it again. You're going to want to do everything possible to keep your blood sugar above 70. But we don't want it to keep it too high. We want to keep a nice, steady level. Most of the time, going from low to high is that roller coaster ride. And this is actually more damaging to your body in the short term than you being high all the time is in the long term. So this is more damaging. So we want to avoid that as much as possible. Now, keeping normal for most of the time, anywhere from 100 to 120 is a great number to be at, and a very comfortable and safe number to be at. And anywhere from 70 to 120 is what your body normally, for somebody who doesn't have diabetes, that's what their body keeps them at most of the time anyway. So that is considered a normal level. Bumping up above that, and if we, what I used to call, if we ride at about 150 all the time, then that can increase the risk for complications, and that's something that we don't want that either. So staying in the normal range as much as possible is really the best place to be. All right, high blood sugar levels or hyperglycemia. Hyper meaning high. So this is your high blood sugar levels. It's a blood sugar that's greater than 240. And when blood sugar, or actually this is a blood sugar level that's greater than 100, really 140, it's considered hyperglycemia, anything that's above that. So when we're greater than 140 though, there's this thing called ketones. Most people probably know about ketones from keto diet that we hear now, but ketones are actually formed in your body when when the glucose can't get into your cells. Those cells still need to have something to give them energy, so your body will break down fatty acids. Okay, you may think, ooh, fatty acids, nah, that's not always the best thing. Not always the best. Ooh, I'm breaking down some fat. Not in this way. We don't want to do it. So it's breaking down, then ketones are forming. And those ketones, your cells will then use that ketones for energy. Doesn't work as well. Doesn't work as efficiently, but it still will work. But when ketone levels and blood sugar levels are high and ketone levels are there, that can actually be a pretty big indicator for diabetic ketoacidosis. And that's something we'll talk about in just a minute. So there are some test strips. You can get finger blood test strips to test ketones, or you can pee on a stick. So easiest way really is peeing on a stick, but the most accurate way is to prick a finger. The blood ketones is your most accurate. However, it's expensive. And the least expensive way, and truly the easiest way, is just to pee on a stick, wait 15 minutes, read your ketone levels, and it does have a range. There's little shading. It's a graphic or a picture on the side of the box, and you just match up what shade that your keto stick looks like, and that tells you how many ketones are in your system. For somebody who may have been pregnant and had gestational diabetes, you may have been given some keto sticks to test urine ketones at that point to see what your keto levels or ketone levels are. So you can buy them. They are fairly inexpensive. You can get them from almost anywhere. I get mine. I do keep them. I don't use them very often. I did have to use them recently because my pump died on me. So I woke up with a blood sugar of 500. Mm-hmm. Now with that is a little bit scary. So with that, I keep them, but they do expire, so you will have to replace them annually. One thing, once you open up that container of keto sticks, they're only good for 6 months. So you need to write the date that you open it and then throw it away after 6 months, because what that's going to do is if you use it after that 6 months, all that little testing chemicals on the end of that little stick, they may not work well, and you may get an incorrect or an inaccurate reading.
Good tip.
Okay. So Paul has type 2 diabetes, and he says, it's embarrassing to take my insulin when I'm out with other people, so I just skip it sometimes. You can go to the bathroom, go back to your car. There's lots of places that you can give that you don't have to do it in front of somebody or do it at the table at a restaurant. My favorite story is I was in Korea. I went to the restroom to give myself insulin. In the bathroom was another girl giving herself insulin.
Oh.
We made friends. I was in there for 30 minutes talking to her. My husband had to come knock on the door and make sure I was okay. So I know she worked at the American Embassy, and it turns out that she had type 1 diabetes too. So we just carried on a long, wonderful conversation about traveling around the world with insulin.
Right, I bet.
So sometimes you never know who you're going to meet. Sometimes you never know what you're going to come in front of, or who you're going to come in front of whenever you do have it. You might find it amazing that other people will go, ooh, I have the same thing. Or I deal with the same thing. I totally understand what you're doing. The most important thing is really not what other people think about you. The most important thing is that you take care of yourself. So you give yourself insulin when you need to give yourself insulin. And then, or there are some, and Caroline, you tell me what you would recommend. There are some depending on, Paul has type 2 diabetes. So he may not give himself a lot of insulin, maybe a smaller amount of insulin. Would you tell him to have maybe only protein for that meal and then give himself insulin afterwards? Or would you recommend that he eat whatever he would normally eat and give himself insulin afterwards?
You know as well as I do, that can be a really hard blanket recommendation. So I'm not going to say anything here, but we might work with the individual to determine the right approach. I think that, you know, in this case, I really love your approach. Go and be transparent about it. In this day and age, many people have diabetes and many people know somebody who has diabetes. Enough working knowledge to understand your situation, and maybe that'd be one way to actually help you connect with someone else rather than appease your fear, which would be to make yourself feel uncomfortable as if you were different. So it could actually unify you. So that was a great story.
Thank you for that too. All right, Sandra has type 2, and she says that insulin makes her gain weight. Well, it is a hormone. It can cause some weight gain, but not in the way that we fear it. You know, not in the way that's going to cause you to gain massive amounts. No. Pounds, possibly, but not a large amount of weight. Most people are not going to be on that much insulin. So, you know, it can cause some. It is a growth hormone, or it is a growth hormone, but it is a hormone in your body. But does it cause weight gain? It may cause a small amount, but it's not going to cause a large amount, especially not enough to make you not want to take the medicine. I had cancer last year. The medication that they've put me on post chemo causes weight gain. Am I going to stop taking it? No. So same thing here is take it and then, exercise. I know lots of people who've been on insulin and have lost weight.
Truly.
So they can still make sure that you're eating healthfully and exercise, and that's going to help to keep that weight down.
Great idea.
Sick day management. All right, so we all get sick, and we're in a time where sickness, it's really kind of scary. So sick day management is what we need to do whenever we do feel sick. You know, if we have a small cold, that's usually not that big a deal. Some medications can cause blood pressures to rise. If we have a head cold, some of the medication that we may take for a head cold is going to cause blood pressure to rise. You know, so we have to be careful with that. But anytime that we do have vomiting or diarrhea that occurs more than 2 or 3 hours, that you're not getting a colonoscopy, or getting prepped for a procedure, if you cannot keep any fluid down, and that means you're going to be probably vomiting quite a bit. If instructed to check your ketones, so when blood sugar levels will go high. Now remember, I said earlier that being sick can cause blood sugar levels to rise. It's your body's response. Usually I know when I'm getting sick because my blood sugars will go high for no known reason about the day before. Usually, and I can tell, I'm getting sick. So I'm coming down with something. So yeah, keep those keto sticks available if you have them. If not, you know, get some and then keep those available to be able to check ketones if it's necessary. And then if you're experiencing any symptoms of DKA or diabetic ketoacidosis, and this is going to be include, and it can be really any 1, 2, or 3 of these symptoms, and there's quite a few symptoms that come with it. And it's abdominal pain and nausea. So there's some GI upset and some GI issues. Gastrointestinal is GI. So gastrointestinal issues, trouble breathing. It's a deep, rapid, or I'm sorry, not deep, it's a shallow, rapid breathing, very shallow, rapid breathing. Fruity breath, smells like juicy fruit. And it's like a mixture of juicy fruit and nail polish remover, actually. Severe dry mouth, and then confusion. Confusion is something that's always going to come along with that. Probably the most common symptoms are nausea. Not always the GI or the upset stomach, but sometimes diarrhea comes with that. But nausea is one of the most common symptoms with that. The fruity smelling breath, and then when it becomes pretty severe, it can be that shallow breathing can start coming in. HHNS, which we'll talk about in just a second, is hyperglycemic hyperosmotic non-ketotic syndrome. I may have said that backwards.
I think you got it.
I gotta think, which one is first? These are symptoms of severe dry mouth, warm, dry skin, but not sweating. So clammy, but not sweaty. High fever, confusion, loss of vision. I usually say this is a lot like you're having a stroke. A lot of times the same symptoms of a stroke, not necessarily the numbness, but the same symptoms of a stroke, especially where the confusion comes in. And some people have gone to the emergency room. I've known patients that have gone to the emergency room because they thought they were having a stroke, and actually it was HHNS. So it's some of the especially with confusion, is very similar to a stroke.
Mm-hmm.
All right, so Simone says, type 2 diabetes, I'm sick today and not eating, so I shouldn't take my insulin. If I take my insulin without food, I'll go low. Well, remember, sickness can cause blood sugar levels to rise. So yeah, you still have to take insulin. If not able to eat at all, at least that basal insulin, if it's injected, then it's going to be either Lantus or one of the basal type insulins. Or it may, if you have an insulin pump, then you're going to want to keep that on. You may have to increase that basal rate or do a temp basal at some point to increase that basal rate a little bit. It is, but you still have to take that insulin. Remember, your body either doesn't use insulin very well, doesn't make enough insulin, or doesn't make any insulin. So you still need insulin because sickness is going to cause that blood sugar level to rise. All right, ketoacidosis. This is diabetic ketoacidosis we talked about a while ago, DKA. This is a medical emergency. Do not sit at home and think it's going to get better. This can cause such a metabolic acidosis. This can cause such a displacement of electrolytes in your body that it can actually lead to death, to coma or death. So this is something that's extraordinarily important to be aware of and to call 911 if ever experiencing DKA. There's thirst and dry mouth. Blood sugar levels tend to be very high, but anytime blood sugar levels are over 250 for a period of time, you can go into DKA. Most often we see DKA in type 1s. It is common in type 1s, but we do see it, especially for those who have type 2 diabetes and are on multiple daily insulin injections, or a lot of insulin. We may see them with DKA as well, if their body, especially if their body doesn't create very much insulin at all. So frequent urination, going to the bathroom a lot, and that's very typical of high blood sugars, right? We've talked about what the symptoms of high blood sugar are, and many of these symptoms are the same symptoms of high blood sugar. High ketones in the urine, we're going to see that from moderate to high level of ketones in the urine when you pee on a stick. The lethargic or fatigue, very, very tired feeling, and we've already talked about some of these same symptoms earlier, but confusion. By the time it gets to confusion or diarrhea, and some of the difficulty breathing, you're already in a very severe part, or a severe type of DKA, because it can be mild, it can be moderate, and it can be severe. By the time it gets to the confusion and to diarrhea or difficulty breathing, now we're starting to talk to some of the more severe symptoms, and that is absolutely has to go to the emergency room. If you're in mild DKA, you probably need to go to the emergency room to be sure. Magnesium, sodium, all of these nutrients that are in your body, they're called electrolytes. They can get out of balance, and they can actually lead to death or coma if they're not taken care of. All right, HHNS, I said it backwards. It's hyperosmolar hyperglycemic. I do it every time because it's about hyperglycemia. I want to put hyperglycemia first. All right.
I thought you did great.
Hyperosmolar hyperglycemic non-kyptotic syndrome, or HHNS. So this one doesn't happen as rapidly. DKA can happen very rapidly. Now, within a couple of hours of blood sugars being greater than 250, somebody can start going into DKA. They correct that blood sugar level, then probably not going to go into DKA, but they can start going into DKA if blood sugar levels are greater than 250 about 2 hours after at 250. So blood sugar levels for HHNS are extraordinarily high, 600 or more. I've actually seen patients with 2,400, a little bit more than 2,400 blood sugar.
That's a big one.
So it can go extremely high. So this is a blood sugar that's greater than 600. Some of the same symptoms as DKA, with extreme thirst or dry mouth, increased urination. So many of them is the same, but that skin is going to be warm and dry, or a little bit clammy feeling. So there may be some drowsiness or confusion and hallucination, and this is where that feeling of almost like a stroke. So if you think somebody it doesn't matter if they are having a stroke or HHNS, it's still a 911 call. They need to get to the emergency room. Typically, this one starts off with dehydration, and then it just goes on from there. So, blood sugar levels can go very high, but this is a medical emergency. Need to go to the emergency room ASAP. Especially when blood sugar levels are that high, emergency room visit, period. So those meds to avoid, a lot of these are over-the-counter medications to avoid, especially when ill. Cough drops and cough syrup contain sugar. You can buy sugar-free. Be careful with those because they contain sugar alcohols, which can lead to diarrhea and gas and all the other fun stuff. Don't overtake those. Be careful when you take those. They're fine, but be careful not to take too many of them. But cough drops and regular cough drops and regular cough syrup do contain sugar, and that can cause blood sugar levels to rise. Sudafed products, these are going to cause your blood pressure to rise, and then any Tylenol products will also cause blood pressure to rise. So we want to be careful with how much we take of those. All right, every setback is a setup for a comeback. I love that. I love that. Every setback is a setup for a comeback. Sometimes we can call those learning experiences, but hopefully it won't happen twice, because remember, we don't want to have to deal with some of this again. So if it happens to us once, we learn from it, and we try to prevent it from happening again.
Well, that is great, Julie. Thank you so much for another fabulous presentation.
Thank you very much.